I love seeing success stories and seeing former students become certified and sharing their success stories. My journey started when my son was in the second grade. I would take him to basketball practices, and there was another mom who was there, and she was wearing scrubs, and I'm like, oh my gosh, coming from the island of Guam, like, she looks very important. Like, what does she do? So I kind of got the courage, and I'm like, hey, so what do you do? What do you do for a living? And she's like, oh, I'm a health unit coordinator. And I'm like, okay, what is that? And then she's like, wow, basically I'm a unit secretary at the local hospital. I'm like, okay, what do I do? How can I become one of you? And she was like, okay, well, just go to school and go take the course and get certified and come on board.
Joylene was certified in 2014 by the National Association of Health Unit Coordinators, known as NAHUC by the members of the organization. NAHUC's core values include membership, education, certification, and stewardship, and is the only agency representing health unit coordinators or those with job titles performing similar tasks. Through the board of directors, committees, subcommittees, and volunteers, NAHUC supports its members at any level.
So my title now is a health unit coordinator instructor for my local college over in Washington called Clover Park Technical College. I have been tenured since 2018, started there in 2014, and I love what I do. I love teaching students what we do as HUCs. I would recommend for anyone wanting to become certified is come onto the website, come onto the NAHU website, and click on every button. Get to know, get to see the link, get to see what each link provides, and that would be the first step, is come on board by clicking on the website.
Certification played a big part in me in my advancement opportunities after becoming certified. Again, it just showed how I took my profession to the next level. Basically, I showed how proficient I was in the skills, and it did allow me to clinically advance and take on more leadership opportunities. So I became part of more councils. As far as unit-based councils, we started a HUC shared governance. So that came with most all our certified HUCs that sat on that, which I still sit on that to this day. That's the HUC liaison. So it did award me many opportunities. We also have like a HUC award too that they give out every year, which I won. I was the recipient in 2014.
I believe having this certification will definitely encourage communication within the HUCs, and provide also become like almost a liaison between other people, the medical staff that we conversate with if we have any issues or a solution, that they're willing to listen to us. And but definitely this will help us because we're all involved we all have our own like unit-based practice councils. And we all want to feel like we're all sharing ideas and we're all accepting new ideas. And this certification just makes us stronger and more of almost a family unit.
The National Association of Health Unit Coordinators Certification Committee maintains and updates the exam in its 4 parts: order management, coordination of the health unit, communication and customer service, and professional development to correlate with the fluid nature of the healthcare industry. These categories carry on to be an integral part of the health unit coordinator's profession.
I would say maybe the biggest category, or on top of my list, is the actual communication part of it. We serve a very needing community, so customer service it's always on our number 1 list, and so we want to, because we serve our patients every day, and we want to make sure that the patients and the family members are actually happy with the service that we provide for them.
Well, certification definitely does help you. The skills that you do learn from being certified does help transcend to the outside world. It helped me build like just better customer service, learning how to, again, just look at, again, not for myself, but look at people from all different aspects. Also, it just helped me with de-escalation and problem, just being a person who can help quickly come up with a resolve. Because we know a lot of times, even in our outside lives as well as just patient care, people, again, they're not in the best situations. So you're the first person they connect to, and I feel like people connect to me a lot outside of work. So I'm actually able to offer advice and help them decipher and de-escalate their situations. So it definitely has helped me a lot. And it's given me more confidence and pride, just in general as a person, because I was always a behind the scenes person, believe it or not. So just being able to be, again, certified and feel like prideful, it's just nice that they're able to see those skills, those leadership abilities or capabilities outside of just what you do every day. And it definitely helps me at home as well.
How I would encourage the exam, because everyone is fearful. Like for my students, we don't say test, we say quizzes. Once you say test, they kind of shut down. Once you say exam, they shut down. So to prepare them for the quiz, we actually go into the NAHU website and kind of do the practice quizzes that is there.
As me, I want to be certified as well. Maybe just spread awareness to the certification, and also give out any training that they would do to succeed in taking these tests. Be certified themselves.
Educating your leadership on certification, because again, a lot of them do not know. I had no idea when I first started off as a HUC about certification until I came to Cincinnati Children's, and that's when I was taught about NAHU. So it does really show your value as how you value your role. It shows that you take it seriously. As certified health unit coordinators, we are here for the staff.
We are here for the nurses. We are here for the visitors. We are here for the providers. We are here for phlebotomy. We are here for physical medicine. We are here for rehab. We are here for endoscopy. We are here for spiritual care. We are here for radiology. We are here for family. We are here for respiratory. We are here for response. We are here for oral routines. We are here for schedulers. We are here for nurse practitioners. We are here for nurse assistants. We are here for telemetry. We are here for IT. We are here for housekeeping. We are here for EKG. We are here for case management. We are here for social work. And we are here for the patients.